I started feeling weak. I started losing appetite. I started, slimming. Then I used to go to a doctor. He checks malaria, he checks typhoid, all this. But then nothing was improving. That prompted me now for these thorough checkups. And then from there, he discovered my kidneys had failed.
All right, September 1st to 5th is Kidney Awareness Week, and it is my responsibility as your health communicator to bring to you this conversation so that we can create awareness and learn about our health. This time around, we're talking about kidney disease. I am not alone. I'm joined by a guest who will take us through his journey with kidney disease, where it all began, the symptoms he had, so that we can know what do we need to do. How should we be able to, what questions rather do we ask when we visit a health practitioner? Karibu sana.
Thank you.
Kindly introduce yourself to my viewers and tell us who are you and why are you here today? What are we going to talk about?
Okay, thank you so much. My name is Sami Tiroktogon. I am a kidney patient.
Yes.
I got this disease about 21 years ago. How it started, I didn't know what it was.
Okay.
I started feeling weak. I started losing appetite. I started, slimming. Then I used to go to a doctor. He checks malaria, he checks typhoid, all this. But then nothing was improving until one time he admitted me at the Nairobi hospital, for thorough checkup. And then from there, he discovered my kidneys had failed. Now, it is a shock.
Yeah, it is.
Yeah, it is a shock. And both of them had failed. And then now I started me on treatment. He took me to a kidney specialist who now counseled me that this disease is treatable. And then from there, he took me through the dialysis.
Now, maybe before you get to the dialysis part, I would like to understand, how was your life before then? Because most of these diseases, we are told it's lifestyle diseases.
Yes.
How was your life before the diagnosis?
No, I was very healthy, very active. I used to work in the corporate world. I worked with a bank, then I went to the petroleum industry. And I was very active, There was no problem until that now I started feeling weak, started losing appetite. And then from there, I reduced in weight. That prompted me now for these thorough checkups.
Now, does it mean that while you are, let's say, losing appetite, is there any form of treatment that you were receiving? Were you diagnosed with any other diseases before the kidney diagnosis was done?
No, not at all. Yeah. They were checking other common diseases.
Yes. The likes of malaria.
Yeah, malaria, typhoid, ulcers, all this.
And you're given medication for those?
Yes, for sure I was given, but nothing was changing.
Okay.
Yes.
Now, after the diagnosis, take us now through the journey of being diagnosed. What happened next? What are the steps that followed?
No, after being diagnosed, now this when I was taken to a specialist, a nephrologist.
Nephrologist, yes.
Now he took me step by step. That's when now the tests began. A lot of tests were done until now they diagnosed both kidneys had failed. Yes.
Okay. What does it mean for the kidneys to fail? One kidney is something else. Both kidneys failing is something else.
Yes.
What did that mean to you at that moment?
Oh, it means now I had no kidneys.
Okay.
Yes. And I used to feel like vomiting when I take food. And I was not active like before. And it was a scare that now you have no kidneys. And from there on, he used to give me some medications, but he took immediately me for dialysis.
Okay.
Yes.
Okay, so treatment began.
Treatment began.
What does treatment for kidney failure look like?
Oh, it's first of all, it was a painless disease where you don't feel any pain here and there. And then when the treatment ceased, the dialysis began. Most of the time I was taken through lab tests, checking this and that, and then some medications, and encouraging somebody through this journey of life. Things now took a different turn. Yes. Now where you need to involve the family now to know what is going, and it's a very expensive disease to treat. Yes.
When you say expensive, tell us about it. In terms of costing, was there transplant needed?
Costing, for dialysis is a heavy cost as well. That time it was around 7,000 to 8,000 per session, and you have to go two sessions per week. Yes. And then tests every now and then. And then the food, you had also to change the food.
Diet.
Yes, diet, Diet. Seeing the dietitian again is an additional cost. Yes.
All right. Does this mean now you had to undergo a transplant?
Yes. After going several sessions, I was told, for me, I need to do transplant. Now that's a different journey again. I have to get a donor who is willing to accept. Luckily, I have brothers and sisters, and then my dad then called us for a meeting. And when I started dialysis, he had to come. All the relatives used to come and touch. And it's scary when they see blood going around, flowing, and then they were wondering what kind of disease. By then it was not common.
How long ago is this?
That is 2004. Yeah. So now when the issue of the donor came in, now all my brothers were assembled, my sisters. Then the compatibility tests now began to see first if it's somebody to accept, and then given that assurance that life will continue. And then my young brother, who was 20 years then, accepted that he was willing to donate his kidney for me. And then he came up. Then he went for counseling again that life will be normal after the kidney has been removed. He was not married. He was told you will still get married, you still have kids, you'll do everything normally. Yes.
I think that's the fear to most people.
Yes.
When you hear about donating an organ, most people think now I have to change my life completely. I will become sick. I will stay in hospital for a long time.
Sure.
How was it for him and for you?
It was worrying that my life be restored again. For him, it was even worse. He was 20 years. Imagine a youth of 20 years going for transplant. For my mother, having 2 children now, going in hospital, it is so scary.
But was he okay eventually?
Yeah, he was very
How long did it take for him to be in the hospital?
Oh, it's less than 10 days or something.
Okay.
Because we went to India to do transplant again because of the cost. It was cheaper comparing the cost of that process here, treatment, and here it was cheaper there. So we went there. And then my wife was there also to come and look for 2 patients now.
You had to take care of 2 patients.
So we were prepared for it. And then with him, I think he was passionate because he wanted to save life. So he didn't worry, he didn't fear, he was very positive about the life after transplant. So from then, he came out after a few days. He was becoming a tourist.
He was just moving around.
He was moving around with life.
And helping to take care of you now.
Yes, now he was the only patient. After a few days, I came out of the hospital, looked for the apartments outside, and then I used to go for visiting, for checkups, for tests, and all those. And everything went so smooth, everything went so well. Yes.
Now, after the transplant, there are people who have come out of the transplant, but maybe because of infections or post-care treatment didn't go as it was thought to go. For you, it went well.
It went well, yes.
Tell us now the post-care period.
The post-care period, you have actually to accept that this is a new life, and take very clear instructions from the doctor, from the dietitian, and become obedient. Follow this new life, follow the diet, the lifestyle. Don't eat the food which is not recommended by the dietitian. Be active in life. Take a walk. And then be careful. Avoid crowded places which are not hygienic.
All right. When you talk about diet and foods that are not, advised, what kind of foods have you adhered to since then up to now in terms of your diet?
Avoid foods like red meat. A lot of proteins. Salt. A lot of oils, cooking oils. It's very a lot of vegetables, white meat, especially fish, chicken. And everything in moderation. Yes, and a lot of water. That's the medicine. Me, wherever I walk, I have water always in my life. And also, don't do physical activities which can harm you. Don't lift heavy lifting, light lifting, and then avoid where there are quarrels. You need to have a place where you are not stressed.
Peace.
You need peace. You need joy. Those are the people you need with. People who encourage you. People who want you to succeed. Go to work places. Now this is where you now go to church.
So Sammy, that time your younger brother was 20 years. How old were you?
I was 40.
40
years.
More than 20 years later.
Yes.
How are you feeling? What would you say you've learned from your journey as a kidney patient?
This disease. It is treatable. It is you resume your normal life. You continue. I went back to work, and now I'm normal. I'm very normal, and I encourage somebody who is fighting with this disease that it is possible.
Now, the reason we are having this conversation, especially now as a country, non-communicable diseases are now, people are talking more about non-communicable diseases. However, our health systems, our insurance, as you've said, you had to travel to India for treatment. Right now, the traveling has reduced, but still the burden has not gone down compared to looking at how fast the health systems are growing in the developed countries. What do you think about our country when it comes to handling non-communicable diseases?
Wow, I think there is improvement since then. But as they are doing well, we request them actually to look on the insurance, especially SHA. SHA, it is good, especially for us who are kidney survivors, but they need to streamline, especially the efficiency. The systems, sometimes they are down. And people come from far for this service. And then you can find somebody who has come there, the system does not work. He has to go back without medication. So we request the government actually, they should improve the services and also to become accessible. There are those areas where the services are far. They need to be there, and availability also of the medicine. At least the doctors now, we have doctors, but more or less they are concentrated on the urban areas. They need. We need to have some also in the remote areas. And also the medicine to be always accessible, and also be taken to those areas, and also consider also the price of medicine. It has been coming down, but we will appreciate if they come down.
More subsidized.
More subsidized
prices.
For the patients, and also treat these people that they are patients. Let them have where they are served. Let them have where they can get services quickly.
Especially considering non-communicable diseases. This is a life, most people live with these diseases for a very long time.
Sure.
If they're not taken care of or they're not given priority, then it becomes a burden not only to an individual but to the family and to the community.
Yes.
What would you say the burden was to your family when it came to now treating the kidney disease?
Yeah, you know, when one member of the family is sick,
Yeah.
the whole family is sick.
True.
Because the focus, the attention, and they abandon other responsibilities so that they take care of the patient. Especially some diseases where it needs somebody to be uplifted, to somebody to be, taken around.
Yeah.
It is expensive to the family.
Okay.
And for those who are taking care, the caregivers, they should also give them some time off the work or reduce the load because they are taking care of the patients. Yeah,
I agree with you because now again I think also we've not spoken a lot about caregivers.
Yes.
I don't think people are keen to understand what caregivers go through when it comes to taking care of the sick because again they didn't expect that will be a role that they will be played. Some caregivers have had even to leave their jobs to just take care of their relatives or their sick people at home. And we appreciate caregivers, especially those who are taking care of patients of non-communicable diseases. Now, Sami, to our facilities, one thing I know for sure that most people have spoken about in this area of non-communicable diseases is the aftercare, after treatment care for patients with non-communicable diseases. Do you feel like our health facilities are equipped enough for the aftercare, the ICUs, and even the services that are offered after our patients come out of theatre? Do you think our country has sufficient facilities and equipment to take care of patients?
Yeah, they have tried, but there is a lot to be done.
Okay.
Yeah, especially people who are disabled. Yes. Accessibility to buildings, accessibility to offices, and also I think the focus first is on the patient, but then these other caregivers, they also pour a lot of psychological thought. You can see how they are, and they need to be supported also with what we call counseling. They need counseling. They need also to be involved on what is required to take care of the patient. Yes. Which is very critical because without them, to sustain a patient is not easy.
It's not easy.
Yes.
Very true. Maybe your parting shot, Sami, to patients, kidney patients. Now we are marking this week of September 1st to 5th. It's Kidney Awareness Week. What message do you have for patients, for caregivers, for the system, for policymakers across all basically the divide?
Yeah, I think I'm there to give them hope. That there is life after treatment, after transplant. Yeah, they should pursue their normal life. They should participate in building this nation, and also to request the government to give them opportunities to work, to serve in this country, because they are valuable. They are still valuable. Most of them, they are skilled people. Some are engineers, some are doctors, some are they have values in this life, so they should be given an opportunity to serve and also improve their services. It is good, like kidney transplant patients, they are now grouped as PWDs. It is a good development, but they should now open up space for them to serve this country. We don't need so much sympathy. We need that, what we call
support.
That's what we need, support.
Correct.
We can do our work for ourselves like before. But they should take care of us, the patients, the caregivers. Yes.
Oh, nice.
Give them space. Yes.
So, Sami, one more thing. Recently, we've seen in the dailies, in the news, there have been allegations that some facilities have done kidney transplants with the intention of selling, which is organ transplant and organ trafficking. What is your thought about that? And when you were supposed to undergo a kidney transplant, was buying an option for you?
No, I think. First, I think it's illegal in this country, the organ harvesting. I think there is some investigations going on.
Yes.
It is not right. When you want to support somebody, support somebody.
Yeah.
Yeah. So when I was looking for a donor, they say you first start from your immediate family.
Okay.
Yeah, but that option of buying, it is not there.
It wasn't there.
It wasn't there.
Okay.
So I should encourage people that they should not sell. This is life. You cannot trade with life. And I was approached actually. Some people are calling me that we understand you are looking for a donor. I'm willing to give. Let's talk. We agree on the price.
Oh, really?
Yeah. I don't know how they get
information. Do you think it's from the hospitals?
It could be, because you get somebody calling you, asking, oh, you are looking for it. Have you gotten one? And then I am available.
What?
Yes. I think that confidentiality should be enhanced.
Okay.
Yes.
Yeah, that's important.
Yes.
I think it's about confidentiality.
Yes.
Because there's no way someone from nowhere will just call you to ask you.
They just call you and ask you, yes, I'm available. Yeah, we can agree on the pricing. It's like trade.
Patients, confidentiality to hospitals. All right. Thank you so much, Sami, for joining us. And one thing I think I've taken from this is basically, first of all, early diagnosis, which is important.
True.
Secondly, improved systems that will enable treatment to be done effectively.
Yes.
For medicine to be subsidized and the prices to go down.
Yes.
To remember to support patients who maybe have undergone transplant and to give them opportunities. And to remember the caregivers who are doing a very good job in taking care of patients.
Something I forgot.
Yes.
Research. Yeah. Well, write the request to put a lot of finance on research for these diseases, so that, as you say, to be diagnosed early, and also for prevention.
Yes. In fact, prevention is better, and I feel that is one area that our health system has not put attention to it. Preventive measures, not waiting for curative measures.
Exactly.
We have invested so much in curative and have let down our preventive measures. And if we go that direction, I believe it will go a long way in making sure that our health systems are better. And as we mark this week of Kidney Awareness Week, to all stakeholders, from the community up to the government, it's our responsibility to ensure that we take care of ourselves, take care of our bodies, go for regular checkups, eat healthy, live a healthy life, and take care of ourselves in the best ways possible. Until next time, allow me to say goodbye, Sami. Thank you so much for joining us.
Thank you so much.
And to you, my viewer, thank you for tuning in. Let's all create awareness around these lifestyle diseases and make the community the best place for us all. Until next time, it's a wrap.